Hi everyone, today I'm going to present my research article. The title of the article I chose is Moral Distress and the Nursing Care Quality, a Correlational Study in Teaching Hospitals. High quality of care is very important in healthcare delivery systems. Nurses deliver a majority of patient care and can be subject to moral distress. Moral distress is an important issue in nursing ethics, seeing that nurses' attitudes are essential in patient care. In nursing literature, moral distress is defined as distress that occurs when one knows the right thing to do, but institutional constraints make it nearly impossible to pursue the right course of action. The purpose of this study was to investigate association between moral distress and nursing care quality in the ICUs, CCUs, and psychiatric departments of teaching hospitals affiliated with the Tabriz University of Medical Sciences. The questions being posed are: is there an association between moral distress and ICU nurses? Is there an association between moral distress and CCU nurses? And is there an association between moral distress and psychiatric department nurses? It is believed that moral distress causes nurses' caretaking capacities to decline. It appears that the level of moral distress in nurses varies depending on the environment and governing regulations and should be investigated in different wards. Having knowledge about the causes of moral distress in nurses can help to develop preventative strategies and programs. Moral distress adversely affects nurses' quality of working life, including taking care of the patients. Those are just some of the theories behind the research that was done. The sampling for this research used census sampling and was conducted within 11 months, from November 2013 to September 2014. The study involved 10 different hospitals. The sample size was decided to be 602 nurses. For the inclusion criteria, the nurse had to hold at least a bachelor's degree. Um, she or he had to have worked in the department of interest for at least 6 months, and they had to volunteer to participate in the study. Data collection was conducted by a 3-section questionnaire consisting of a socio-demographic questionnaire, Corley's Moral Distress Scale, and Quality Patient Care Scale. For Corley's Moral Distress Scale, it consisted of 3 domains, the first being namely disregarding the patient, which had 16 items on it, decision-making power, which contained 6 items, and professional competence, which contained 6 items, to measure the level of moral distress based on the triggering clinical situation using a 7-point Likert scale. For the Quality Patient Care Scale, it consisted of 68 items assessing nursing care quality in 3 domains. Those 3 domains were psychosocial, and that part contained 32 items, physical contained 23 items, and relational contained 13 items. The Quality Patient Care Scale items are rated by a 4-point Likert scale, never being 1, sometimes being 2, often being 3, and always being 4. Data analysis was conducted by descriptive statistics, frequency, percentage, mean, and standard deviation in SPSS 13 to determine the levels of moral distress and nursing care quality. In the study departments of the 10 hospitals, 52.8% of the participants reported to experience moderate levels of moral distress, and 41.3% reported to experience high levels of moral distress. The mean scores for moral distress and nursing care quality were moderate and relatively desirable, respectively. According to Pearson correlation coefficient, the 2 variables were not correlated, and a t-test indicated that nursing care quality was more desirable in the psychiatric department. Even though the present study determined that moral distress was not effective on the quality of healthcare services, it was observed that inadequate staffing and delivering nursing care not per the standard procedures were reported to be significant causes of moral distress. Overall, the study answered the research questions by analyzing each department's surveys using descriptive statistics. The study was limited to 10 hospitals for the survey, and due to a number of unforeseen events, 57 nurses had to be excluded from the study. In conclusion, the recommendations of the research was that further research should be conducted in association between moral distress and the quality of care from both nurses and patients' perspectives. I hope this presentation was informative. Everyone have a good day. Thanks.